Thanks, Mr. Derrickson. It's my pleasure to introduce this morning our student speaker. Michelle Livings is graduating from the MPH program with a concentration in biostatistics and a 4.0 GPA. Her thesis is titled Maternal Preconception, Health and Neighborhood Factors in Relation to Preterm Birth in Georgia, 2012 to 2014. Throughout her program, she served as a graduate research assistant under Dr. Betty Lai, where she helped to validate a screening tool for child sex trafficking. Michelle has completed her practical in chronic disease, healthy behaviors and injury, epidemiology at the Georgia Department of Public Health, where she performed an analysis of the Georgia violent death reporting system. She's currently working as an epidemiologist at the Georgia Department of Public Health. Her future goals include earning a doctoral degree to becoming a college professor. So please welcome her.
Thank you, Dr. Lynn. Good morning, everyone. I'm so honored to be speaking to you today, and I'm honored to be graduating with such an extraordinary, brilliant, and talented group of individuals. I've taken a winding road to get to this point, as I'm sure many of us have. I'd like to tell you about my journey and talk to you about passion and opportunity this morning. Before coming to the Georgia State University School of Public Health, I had lived my whole life in New Jersey. I studied chemistry in undergrad, I completed 2 years in a chemistry PhD program, and then taught high school chemistry for a year, during which time I realized that chemistry was not my calling. I then spent 3 years working at random places, including Nordstrom, Qdoba, 2 casinos in Atlantic City, and Kaplan Test Prep. I got my EMT certification, I completed all the prerequisites for nursing school, I actually got hired for transport EMT, and on my second day of training as a transport EMT, I was in a wound care visit with a patient. I fainted and hit my head on the wall and got a concussion, which led me to the conclusion that medicine and nursing school in particular was not my calling. I then met with an Air Force recruiter. There's some Air Force members in my family. I met with an Air Force recruiter about officer training school. I was told that I was automatically disqualified because I have a tattoo above the level of my collarbones on the back of my neck. The recruiter suggested, he said he could not technically suggest, but that I may consider having it laser removed to be eligible for active duty. But it's my favorite tattoo, so I concluded that the Air Force was not my calling. Finally, in August 2015, I decided that I needed to go back to school. I researched public health careers, and while I didn't really have a firm grasp of what people in public health actually did, I thought it made sense, given my background, to try to stay within the realm of medicine and health. So I applied to 7 public health programs that accepted students for spring admission, and ultimately made the decision to move from New Jersey to Atlanta. Last summer, multiple family health problems arose. I was 12 hours away from my family and unable to get home. And over the past year and a half, I've lived with a lot of guilt and grief and many borderline regrets. But I'm thankful to my family for being completely supportive and encouraging of my attending school and building my life here in Georgia. I've earned this master's degree for both of my grandmothers and for my parents. Thank you guys. I've had so many opportunities at Georgia State that I know I made the right decision in moving here. I'm beyond fortunate to have spent almost 2 years as Dr. Betty Lai's graduate research assistant, and during this time, I've had hands-on experience with every aspect of research and publication. I was able to study abroad in Brazil last year, an experience that has shaped the way I think about public health, research, and also family. I've taken classes outside of public health, purely out of interest and curiosity, which is how I met several other mentors at Georgia State in the School of Policy Studies, the Urban Studies Institute, and the College of Education, all of whom have helped me to further develop as a researcher. I completed my practicum with Michael Bryan at the Georgia Department of Public Health, which has led me to a job with the Georgia Department of Public Health, specifically the Georgia Pregnancy Risk Assessment Monitoring System, or PRAMS for short, in the Maternal and Child Health Epidemiology Unit. Through opportunities that I've had at Georgia State, I've discovered a passion for maps and spatial analysis and also health disparities. In my current position with Georgia Prams, I'm performing statistical analyses to investigate disparities among recent mothers in different sociodemographic groups. I'm submitting abstracts with the goal of presenting my work at various conferences. I'm doing background research for spatial analysis that I hope to write up as a manuscript for publication. I never pictured myself working in maternal and child health, but I grabbed an opportunity that was offered to me, and in my position, I'm able to incorporate all of my passions and to conduct original, meaningful research. I'm fortunate to have a job that I love leaving this program, and I'm excited for what lies ahead. I hope each of you are equally excited for your own careers and futures. So I've told you about my background and experience this morning to stress to you that opportunities may come in unexpected packages. An opportunity that you may not think, or that you may think may not be a good fit for you based on your experience, interests, and goals may help you to discover an unexpected passion for something new, or may eventually lead to your dream job. Any opportunity could be the opportunity that you want or need. Keep an open mind. I remember 2 takeaways from our MPH program orientation. The first takeaway is that biostatistics is sexy. Thank you, Dr. Mason. The second takeaway, and in my opinion, one of the most impactful things that has been repeated and reinforced throughout this program, is the importance of networking. During our orientation, practically every topic that was discussed eventually came back to networking. I consider myself a forced extrovert, meaning I'm an introvert by choice and an extrovert by necessity. And I remember thinking multiple times during orientation that I could be successful without networking. I've always managed to get a job or to get into a program, but over the course of this program, while I've been learning what public health professionals actually do and discovering that public health encompasses everything, I've discovered the importance of building and sustaining a network. Public health can be local at the town or county level. Public health can be very specialized, such as identifying and assisting select individuals who have contracted a rare infectious disease. Public health can be very broad, targeting state or national policies to improve the health and well-being of Georgia or the U.S. as a whole. Regardless of scale, public health encompasses everything, and thus collaboration is necessary between coworkers, between multiple departments or organizations, and even between various fields. Building and sustaining a strong network will not only yield opportunities on a professional or even personal level, building and sustaining a strong network will ease collaboration and will make collaboration more productive, enjoyable, and even fun. I want to thank our School of Public Health faculty and staff and our Office of Academic Assistance for being such a supportive and helpful network while we worked our way through this MPH program. My fellow graduates, our faculty, staff, and fellow students and alumni from the Georgia State University School of Public Health make up a spectacular network of individuals with varied interests and experiences. Some of the classmates, professors, and staff that we've met in this program will turn out to be our lifelong friends and collaborators, part of our research families. Some of our classmates, professors, and staff that we've met in this program may introduce us to our future mentor, future boss, or even future spouse. And some of the classmates, professors, and staff that we've met in this program may offer us the biggest opportunities of our careers. Any opportunity may be the one that helps you discover your passion or leads to your dream job. Take these opportunities and keep networking. Help other people in your network when you can. Keep in touch with each other. Go to conferences and talks. Meet new people and build new bridges. Introduce your friends and colleagues to each other. And most of all, keep caring about each other and keep encouraging one another. My fellow graduates, it is our time to change the world. We may have varying interests, from chronic or infectious diseases to healthcare policy, from epidemiologic surveillance to program design, from health promotion to statistical analysis, from local public health to global health. Yet we are all public health professionals. Public health encompasses everything, and we all have vital roles to play. Some of us will move on in academia, earn fellowships and additional graduate degrees, become professors and researchers, shape the minds and lives of students, and work with and learn from people around the world. Some of us will work for local or state government offices or for the federal government, and will be an integral part of improving the health and well-being of our friends, our neighbors, our communities, and our country. Some of us will branch out to related fields such as policy, law, education, biology, psychology, sociology, anthropology, medicine, disaster management, geography, or emergency preparedness. Public health encompasses everything. A large door is opening for all of us today, and the opportunities are endless. Congratulations, Fall 2017 Public Health graduates.